warm welcome if you're just joining us for this consultation on Immunization Agenda 2030 Strategic Priority 1. We'll be starting, as you can see, in less than 2 minutes, 1 minute and 50 seconds or so. We'll be kicking off, and we'll be handing it over to the co-chairs of this special session, Dr. Folake Olayinka, who's actually the chair of the IA2030 Working Group that is hosting this session today, and Dr. Palenfo Dramane, who is a seasoned scholar, alumnus, meaning participants in the Geneva Learning Foundation immunization program, courses, and other activities. So in 1 minute 20, we'll be kicking off with Charlotte and Boo, of course, and myself here to support and help facilitate this session, make this a great session. See you soon. Welcome to you joining this, just joining this session. This is part of Teach to Reach Connect 4. We're going to get started right away and dive in. I'm here with Charlotte and Boo. We're going to hand it over to the co-chairs and the facilitators from the Working Group 1. Charlotte, how are you doing before we dive in?
I'm doing great, Reda, and hello and warm welcome to everyone. I see all of our panelists and the moderators of this session. They are already here, so I'll just hand over to them, Reda. Thank you.
All right, wonderful. And just to get the slides lined up, but before I share with the slides and the panelists for this session, just to show you, again, you can go to the reception area in Hopin and you will see all the different sessions that are happening. Minja, our colleague, just put out the general announcement, so you can come to this consultation or go network. We, of course, encourage you to come to the consultation. Here is the opening slide. Over to you, Dr. Folake Olayinka, Chair of Working Group 1 of Immunization Agenda 2030.
Thank you very much. Good morning, good afternoon, good evening, depending on where you are in the world. It's not only exciting to be in the consultation today on safeguarding and strengthening routine immunization and primary healthcare during COVID-19 vaccines rollout, but it's also timely. I welcome you on behalf of the IA2030 Strategic Priority Area 1 Working Group, which is focused on immunization programs for primary healthcare and universal health coverage. I'm joined with many of my colleagues in the working group today, several of which will be participating and moderating in the consultation today. In spite of huge efforts to mitigate the effect of COVID-19 pandemic on routine immunization and primary healthcare, every region has been affected, and the numbers of zero-dose children increased by 3.5 million in 2020. We've seen reversals of the gains made in the past decade, and more cases of disease outbreaks are being reported in this year. So finding the right balance to ensure we close immunity gaps and prevent vaccine-preventable diseases At the same time, achieve high COVID-19 vaccines uptake urgently is not only important, but imperative. There are also important opportunities to not only safeguard immunization, but to strengthen immunization and primary health care. For example, improve supply chain, digital tools, systemic expansions, new partnerships. Immunization Agenda 2030 lays out the global vision and strategy for the next decade, with a focus on leaving no one behind. There are 7 critical strategic priority areas, including this one, which is an overarching priority in the IA2030 agenda and connects immunization and primary health care with universal health coverage. In the 22 November Launchpad Hackathon, many of you participated on this very topic of safeguarding and strengthening immunization and primary health care during COVID-19 vaccines rollout. Some important points emerged from that meeting, such as the opportunities to reinforce communication during COVID-19 vaccines rollout about routine immunization and vice versa. It was also an opportunity for looking at the use and scale up of digital tools. Today, we will learn more on this topic and hear from the wonderful lineup of panelists and participants on this important topic. And now I am pleased to introduce the moderators for the panel and also my co-facilitator, Dr. Palenfo Dramane. Dr. Palenfo Dramane is a data manager with the Agence de Médecins Préventifs based in Abidjan, Côte d'Ivoire. He's also a scholar alumnus and distinguished himself in this program. He coordinates and accompanies program, which is a global network of more than 500 alumni who volunteer to support new learners in the immunization course. The second distinguished moderator is Dr. Rispa Wolombe. She is a member of the IA2030 Strategic Priority Area 1 Working Group and is a health policy advisor at MRAF Health Africa. Her work in advocacy and technical support includes the advancement of the Universal Health Coverage Agenda. I'm really pleased to introduce them. We want to hear from you all today. I welcome you to actively engage, challenge assumptions, share your experiences, and we'll be focusing majorly on these 4 questions today. And so with that, let me invite Dr. Rispa Wolombe and Dr. Palenfo Dramane to move us on. Just before I do that, let me ask Palenfo if he would like to make any statements before the panel kicks off.
Hello.
Yes,
thank you. Thank you, Dr. Folake. Hi, Dr. Risha. I'm very glad to be here on behalf of all the alumni who have participated in different sessions of Teach to Reach, and we will be glad to hearing from others to share experiences with them and to know how they are dealing with this very important theme on IA 2030. Thank you.
Thank you very much, Dr. Palenfo. So with that, I will turn to Rispa Wolombe and yourself to move us on to the panel. Rispa, over to you. Thank you.
Thank you, Folake, and I'm excited to be here. I hope you can hear me. I hope you can see me, and I hope you're just as excited as I am. So we have a very exciting panel with us today, and we have really critical questions that we want to get started with answering today. And I think I'll get started with just introducing the people we have with us today to, share our thoughts and share, just let's get down into the questions. So I'm going to start off with introducing Yasir Shafiq, who is a senior manager at Vital Pakistan, and also a research specialist at the Aga Khan University. So I'm really excited to have you here, Yasir, and hopefully we'll get down into the details and answer these questions and just really get into how we can answer, the critical question at hand, especially given the context that we're currently operating in. So next we have, I want to also take this opportunity to introduce Professor Christine McCartney. And I would like to, welcome you, Prof. Prof is a pediatrician specializing in infectious disease and vaccinology. She's currently the director of the Australian National Centre for Immunization Research and Surveillance. And she wears another hat where she is a professor in the Faculty of Medicine and Health of the University of Sydney. So welcome, Professor Christine. I will also take this opportunity to, invite Dr. Hilarious Abiu, who is a public health practitioner and the Deputy Director of Public Health, with extensive experience in leading district health teams to improve public health indicators through effective community mobilization, health system strengthening, and research. And I think we look forward to your insights regarding the questions you have today. Dr. Palenfo, do you want to continue with the other introductions? Or should I go ahead? Happy to go ahead if you need me to.
Can you hear me?
Yes, we can hear you.
There's some connection problem.
No problem. I can finish up just because I know we're limited with time. I'll finish up the introductions and then we can jump into the questions, right? So moving on swiftly, we have Dr. Njo Andrea Sateke. I hope I have not butchered your name too much. Dr. Andrea Sateke is from Cameroon. He's a medical doctor who specializes in epidemiology and control of infectious disease. So welcome, Dr. Njo Andrea Sateke. And we also have with us Dr. Aishatu Gubio, who is a fellow member of the Medical Lab Science Council of Nigeria. So welcome, Dr. Aishatu. And our last two, we have Dr. Jessica Shearer, who is someone who we always hop on meetings together with. So I take this opportunity to invite you as well. Dr. Jessica Shearer is an evaluation and learning expert with experience in immunization and primary healthcare systems. And she's currently leading the MEL for USAID-funded Momentum Routine Immunization, Transformation, and Equity, working in 6 countries in Africa and Asia. So welcome. And then last but not least, we have Thomas O'Connell, again, one of the working group members who I have the opportunity of introducing. Thomas O'Connell is a nurse and development economist who currently is a senior health advisor for the WHO's special program on primary health care. And of course, has a vast experience over the past 22 years working with WHO and UNICEF. And I'm so excited. As you can see, we have a power panel ahead of us. And I'm just going to jump right in. And really excited to have each and every one of you with us today. And so we have 4 questions. And we'll also be fielding questions from the panel, the chat box. And so welcoming the participants as well. Please feel free to jump in with any more extra questions you might have. We'll be able to answer them as soon as we can. But I think let's jump into the questions. And I think I'll start off with, the first one we have in front of us, which, what has been your experience in safeguarding and strengthening immunization and PHC services during COVID-19 rollout? And so, Dr. Palenfo, do you want to take over at this point?
Rispa, I think he has a connectivity problem.
Connectivity. Okay, no problem. Folake, can I field this to anyone, or should I just go ahead?
Yes, why don't we kick this? Why don't we kick this off, Rishma?
Yeah, sure. I can mix it up and ask. I'll pick from the list, and I think I'll just start with Yasir because he's staring at me right on my screen.
I like that. Really good.
So yes, Yasir, welcome, and just let us know what your experience has been. Please.
Thank you so much for giving this opportunity to share my experiences from Pakistan. So yeah, the experiences were mixed actually, and still we are as we are entering into rollout of the vaccine. The things are emerging, things are changing. So there are some good and bad things which we have experienced. There are a lot of examples. So one thing which we experienced from in Pakistan, as well as there are other examples from LMIC and LICs, that countries are not ready. They don't have any planning in place to deal with any of such pandemic, any of such disaster. So emergency plan, we have seen that it's not ready, it's not in place, and that's the main reason we have seen a lot of disruption in the health services, especially primary healthcare services, and we have seen that hospitals, the tertiary care hospitals and the secondary care hospitals were not ready to deal with any of such emergency. But the primary thing which was happened, we have seen that immunization services were disrupted. Most of the community health workers, the community-based vaccinators, they were not able to deliver the routine immunization. And just giving you an example from Pakistan, that in the province of Sindh, we lost on a daily basis 3,000 to 4,000 kids to reach to cover for 0 dose. So imagine the magnitude of an issue that which we have faced during the early stage of pandemic. And then when we passed on further. And when the vaccine was rolled out, we also have seen that there was a lot of confusion at the healthcare worker level. The health worker who were involved in COVID vaccine administration versus the routine immunization. So they were not talking to each other. They were not planning together, and a lot of myths and misconception were actually appeared during the rollout of vaccines. And this is something which we really need to think of, that country level planning, both at national level, sub-national level, is really important. And the health workforce need to be ready for any of such pandemic, any of such emergency situation, and how to mobilize resources. That's really important. If we don't mobilize the resources, we know that how much impact this COVID has created on the economies and on the resources. So we really need to think how this planning, readiness, and responsiveness can be done at the country level and at sub-national level, and how we can improve the things which we were not able to do right now at this very stage still. So many countries are still facing this issue. But this process is, we have learned that this is co-creation process which we have done so far. All the partners came together, including the multinational organization, UN agencies, government, Gavi, CSOs, and governments especially. So we all work together, and we are at this very stage that we roll out the vaccine successfully in most of the countries.
Thank you so much, Yasir, because I think you brought out really critical points around, one, I think the last point there around collaboration and the importance of that, because there's a lot of people who are in the space doing a lot of different things, and it's easy for people to get confused, right? And so I guess then the next question I would have, as well as we move towards this, is to kind of also get Professor McCartney's, experiences as well in this, because I guess, working at that level, what have you seen that kind of is related to what Yasir was mentioning, and what can we add to that collaborative approach to things? especially when it looks at rollout and making sure that healthcare workers are working in collaboration as well.
Yeah, thanks so much for coming to you from Sydney, from Australia, a high-income country, obviously, but our collaborative is working in a number of Pacific islands across the north and east of Australia. So, some varied experiences. But I would really echo those comments that any plans where they were in place, they weren't really detailed enough. They weren't really fit for purpose. I don't think we could anticipate the extent of interruption, and the demand on workforce was incredible. And I think not only challenges in workforce discussing with each other, but pivoting, the early needs to implement public health and social measures, test, trace, isolate and quarantine, and everybody dived into that. And then we had to pivot and pivot and pivot again to do something new. But I think for me, some of those positives, whether it's in Timor-Leste or Vanuatu or Fiji or Australia, are things that we thought would never happen have actually happened. So, just in primary healthcare here in Australia, we were trying for ages to get years and years to get telehealth services funded for our healthcare practitioners. We were trying to get digital prescriptions, trying to get mandated reporting to our register to get completeness of immunisation data reporting. And these things suddenly happened. Poof, the mountains could be moved during this time. And some really great things have happened simultaneously with all of the challenges. So I guess my, the innovation and the partnering and collaboration that has made things happen quickly, we have to draw on that. Of course, maintaining routine immunisation has been incredibly challenging. The holdback in new vaccine introductions for some of the countries we've been working with that now are actually just starting to happen, which is exciting. So I think turning some of these newer achievements and accomplishments toward our everything other than COVID vaccines now is the critical next step.
Thank you, because I think everyone is, we're almost looking at COVID as if it's, we're now living with it, and we're moving from that immediate crisis mode to, managing our health systems and going back to delivering on our promises, especially when it comes to routine immunization. And I think that, the innovations that have, come up so far and how quickly they've been managed to be taken up was something that definitely we can learn from. And so I want to turn to Dr. Abiu, who can give us the experience from Ghana and just perhaps let us know what he learned on that front as well. So Dr. Abiu, you're on mute. Dr. Hilarious Abiu, you can just unmute the mic. Can't seem to hear you. We can see you, but we cannot hear you. Perfect.
Am I audible now?
Yes, we can hear you. Go ahead.
Right, okay. So I want to share a few thoughts from my experiences from Ghana. Now, I work in the northern region of Ghana, where we are currently deploying a number of vaccines, COVID-19 vaccines, AstraZeneca, Moderna, Pfizer, and the Johnson & Johnson vaccine. Now, from the very beginning of the outbreak, the leadership in the region, led by the Regional Director of Health Services, was quite clear. There were 4 strategic objectives which guided the approach to the management of the outbreak or the pandemic in the region. And one of them was to mitigate the impacts of the outbreak on routine services, including immunization. So at every stage of the process, there's been a conscious effort to try and ensure that routine services are not unduly interrupted. So when we had the vaccines coming into the region, one of the first things we've had to do was to have a meeting with our district directors of health services, who are largely responsible for the implementation of the immunization rollout at the district level. And one of the things I remember discussing in that meeting was the fact that the manner in which the vaccines were coming in bits and pieces, the campaign is going to roll on for quite some time. We are anticipating that this may drag on to probably the middle of next year, for which reason we needed to get in a lot more staff involved in the immunization space, and then also to train a couple more so that we can strategize in such a way that in each month we have a group of healthcare workers who are deploying COVID-19 vaccination, and whilst others are also focusing on rolling out the routine immunization services. Now, again, along with COVID-19 vaccination came also some resources for training. So one of the things we are doing currently, in fact, this week, for instance, we are training our frontline immunization staff, not only nurses, but data managers, health promotion teams who are involved in social mobilization, and also public health nurses together as a team in both routine immunization and also COVID-19 vaccination exercise. Now, so there's a conscious effort at every level to make sure that whereas we continue to roll out the routine, the COVID-19 vaccination, we are also keeping an eye on the routine services that are being provided. In line with this, as part of the regular feedback we provide to our staff and management across the region, we provide monthly feedbacks on the COVID-19 vaccination, as well as routine immunization services and other services that we routinely provide, just to make sure that our frontline staff and managers are conscious of the impact of the COVID-19 vaccination on other routine services. And I think so far, we've been able to manage to keep routine services going. But again, around this time, we are having increasingly more doses of the COVID-19 vaccines coming in. And by the time they get to us, we have quite a short time because of the short shelf life of the vaccines to get them deployed. This is threatening to bring in a lot more fatigue and also threatening or disrupting, the rollout of the routine activities. So for now, these are the immediate challenges we are confronted with. But again, there's that consciousness that we need to be able to balance the skills in order to make sure that we don't sacrifice other services in favor of only COVID-19 vaccination at the moment. Over.
Thank you, Dr. Abiu. I think you've brought out, again, just really awesome points that are coming through. I think this is tied into, when you have like strong leadership where there's a prioritization of routine immunization along with COVID-19 immunization, you can link that to what Professor McCartney was saying around just making sure there's a fast uptake of innovations, which I think is really critical. And if you have strong leadership at the helm, you're able to take these innovations and put them to scale. And then, of course, Yasir was one who opened up with that collaborative nature. So I think there's some things we're kind of building our own toolkit for making sure that we can scale routine immunization, right? As we continue this conversation, because we really need to answer, like in terms of the experiences that we've had, they've been good and bad. and we want to see how we can collect these, some of the good, and we want to learn from, the mistakes we made. I'm seeing that questions and comments are coming in fast and furious in the chat box. So, yes.
If you agree, I will go through just 2 or 3 comments in the chat.
Fantastic.
And then we've also got comments from Facebook and from the plenary room, from the stage.
Okay.
Go ahead, Palenfo.
Okay, quickly in the room. From Amel Altaher, since Dr. Yassin talked about Pakistan, where I work, we learned that we were not ready to carry on routine immunization activity during emergency at all level. We have also Dr. Sidalinga. Routine immunization day were not disturbed at planning stay of COVID-19 session. It was stressed in all forum, and even the administrator was taken into confidence, not so disturbing routine immunization session. That's what he has said. And the last, we have Dr. James Ball. One of the key enablers, so I think this is the next question. One of the key enablers are the engagement of private sector in participating in COVID-19 rollout plans. They are doing social mobilization among the community. This is only few of many comments that are going on the chat.
Thanks, Palenfo. Rispa, before we go back to you, I just want to show some of there's also a very lively discussion on the stage in Teach to Reach, in the Teach to Reach online conference space, where actually participants in this consultation will be invited to move to Hopin. So if you haven't been there yet, we're going to help you get there in about 15-20 minutes. But we have a message from Rick, Adrian Villegas. Let me spotlight these messages so you can actually see them. I'm not going to read them, that would take too long, but concerned with demand generation, Yatawa Poe. And please do tell us what city and country you're connecting from, where you work, so we get a sense of your context, about her experience in safeguarding and strengthening is linked to community engagement and risk communication. Syed Amar Shah talks about the synergy between the different programs. So of course, we'll be collecting all of these comments, compiling them, sharing them with the working group. So please, even if we don't acknowledge you in this session, because of the constraint of time, we're going to explain how we'll be able to move to another session and also come back and follow up on this initial engagement. Back to you, Rispa Walumbe.
Thank you so much. And I see that we are, again, I even see us building our own little toolkit here, as I had mentioned earlier. So I'm really excited to just draw on everyone's experiences. And I think, for the sake of time and to make sure that we get through as many questions as possible, and also look at how we can build on what's being said in the chat box, I'm going to jump into question number 2. Which I think we've already started to answer, right? Because we've already started to talk about how we can better strengthen immunization and PHC during the rollout of COVID vaccines, right? And of course, the base assumption here is that, COVID vaccination is going really well in all our countries. So we want to figure out what's going on. Is COVID, the way we're vaccinating for COVID, something that we can learn from? And if we can do so, how do we link that to our primary healthcare systems? How do we link that to our ongoing routine immunizations? So I'm going to actually jump into the next speaker, and I would like to call on Dr. Njo Andreas Ateke from Cameroon. If you'd like to take this question on strengthening our immunization rollout and in relation to PHC and also learning from our COVID vaccine rollout as well. Dr. Andreas, please go ahead.
Yes, thank you so much for it. It's really a great pleasure for me to be with the team today. I'm equally learning as I'm going to share my experience in Cameroon. So just like others have said earlier, with the COVID outbreak in Cameroon, we experienced a drop in vaccination for childhood diseases. And this was partly due to the fears of infection in visiting health facilities. So many persons tend not to take their children to health facilities. And this situation even worsened with the current COVID vaccine rollout. with increased vaccine hesitance, not just to COVID vaccine, but also to childhood vaccines in our country. So due to this challenge, we realized that the efforts that we continuously put in were likely not enough. So we began reinforcing communication using every platform, local media, and at every community in the country, and even using local languages. This is one of the approach that has been used to improve. Now, secondly, we looked forward and we began greatly integrating community intervention. Community health workers and community opinion leaders are being used to reinforce communication and to carry out periodic intensification of routine immunization in almost every part of the country. So this is gradually helping to bring up the routine immunization performance in the country in the current context. It's good to note that the periodic intensification of routine immunization was initially carried out in Cameroon in 2020 in 2 regions that faced armed conflict. And during this period, the country was able to gain 15 points in this region for Penta 3. So with this experience gained, we decided to continue with this approach now at a nationwide scale, thanks to the support we got from the various partners supporting Cameroon in its vaccination activities. And so at the moment, PIRI has helped not just to improve routine immunization in Cameroon, but it is also helping to improve COVID-19 vaccination. Cameroon at the beginning had found it very difficult to meet its target, but we have been able to vaccinate more than 1 million persons with more than 500,000 doses of vaccines administered just within 5 days in the last weeks of November, thanks to this community engagement. And also the community has helped to take vaccination services to the doorpost of persons in the community. So the door-to-door approach has been very useful to take COVID-19 vaccination. And to note here, one of the things the team members do is that we try to integrate activities. So the team that vaccinates against COVID equally carries out vaccination against routine immunization. And this helps to reduce the workload on the health actors. So we think that strengthening immunization can greatly be successful only through full community participation. And community participation for us in this slide, we are looking at it that it should be at every step, from planning, resource mobilization, immunization activities itself, right up to evaluation of interventions. Because when the community is able to see the challenges that are involved, to see where we were unable to meet our goal, the likely will help us develop approaches that is going to be acceptable by them to help improve on vaccination services. So this is the orientation we are having right now in Cameroon, and we are really seeing some progress. So summarily, this is what we might say up to this point. Thank you so much.
Thank you, Dr. Andreas, and I think you've pointed out some really important hello? I hope you can hear me. So thank you so much, Dr. Andreas. Dr. Palenfo, do you want to take the rest of the questions and take them through?
No, move on, because I've switched on my phone because of the connection.
Yeah, that's absolutely fine. That's fine. So yeah, I think Dr. Andreas has taken us through something really critical that that's really just made me realize that when we talk about vaccine hesitancy, we're looking at vaccine hesitancy in the context of COVID-19, but we've not in so many cases that I'm seeing that we're also having the overlap with vaccine hesitancy even for routine immunization, which is really taking us back from the gains that we had been making in all our interventions earlier. And so I think the deliberateness or focus on making sure that as we plan, as we have strong leadership, as we look at all these innovations and collaborate together, we really need to be conscious of also how we make sure that once the routine immunization is rolled out or people have access to it, that we've also eliminated the demand barrier. So again, going swiftly on to asking the third question, I want to look at the enablers and opportunities, because I feel like we've gotten quite a bit from the chat box around, how we can better strengthen immunization and PHC. So I want to go into question number 3, and I want to push this question to Dr. Aishatu Gubio. If you could just let us know, from your perspective, from your experience in Nigeria, what enablers and opportunities have you seen in your practice? Dr. Aishatu?
Good evening. Hello, good evening. Can you hear me?
Perfectly fine. Yes, we can hear you.
Okay, thank you. I want to thank you for having me here. So I'll just go straight to the point. The enablers and opportunities we have here in our country, Nigeria. For us in Nigeria, we have and all over the world, we have serious problems and huge problems, a lot of controversies about the COVID-19 virus and the vaccine itself. There has been a lot of misinformation, disinformation about the COVID-19 virus, and right now the COVID-19 vaccine. In Nigeria, especially in the northern part of the country where I work, the people don't take healthcare system seriously. This could be due to so many issues, which include lack of education, enlightenment, and then we have gender barriers, beliefs, cultural norms, and also socioeconomic status. Of course, with the insurgency that we have right now in the state, it is believed that the vaccine itself has an hidden agenda. So to stop fertility, especially, and to inoculate viruses like the COVID-19 and other vaccine preventable diseases into the human bodies. So the enablers I can talk about is it will come with experiences and vast knowledge on the field of immunization, utilizing community-based structures like the youth groups. We have the men hangout groups known as the Majalisa in the northern part of Nigeria. That we also try to involve the traditional religious and the religious leaders in the northern part of Nigeria. And then we try to involve popular celebrities, both at the local and the international aspect. We also have the key gatekeepers and the influencer persons within the communities, like the voluntary community lead mothers. These people stay in the community with others, with the households, so they are familiar with them, they know them, and then they easily accept them when there are issues of receiving vaccines from the community. And then we try to engage and train members from this group, both from the religious group and then the professionals that are in the religious groups. We try to identify these professionals and use them to penetrate into the churches, the mosques, and any other religious aspects there are, so that the relationship can improve and the number of vaccines acceptance can also improve. We also try to strengthen immunization by increasing the knowledge, attitude, and practices of the health workers in the health facilities. We try to build up their capacity in order to enable them, enable the community, accept them, and then also to handle vaccination process in the health facility. Also, the procurement supply chain management is key, and storage and amenities should also be made available in order not to run out of stock of vaccine. Presently, in my country, a number of people have been vaccinated with the AstraZeneca vaccine. We also tried the Moderna vaccine and Johnson Johnson, but we are back to AstraZeneca because it can be easily maintained compared to the other vaccines. Thank you.
Thank you so much. And I think what I'm starting to hear that seems to be a recurring theme is that, looking at what we have and really building off of that is something that's really critical. And I think Dr. Gubio just mentioned around community-based structures and leveraging on those community-based structures, and also making sure that we tackle the whole issue of knowledge, attitude, and practice for healthcare workers. Because we're dealing with we're living in an era of misinformation, and how we handle that, we need to handle it effectively, and we also need to handle it very quickly. So just before I get to question 4, I see we don't have too much time. I want to just allow, I do see a hand up from one of the participants, Mohammed Asif Chaudhry. If you want to just quickly, share your question. If possible, you could share it in the chat box just so we can go through it as quickly as possible. And we can be able to get one of the panelists to answer your questions. So I will jump into question number 4. And we want to really look at what the recommendations are after all this conversation, and looking at tools and the technical resources that we have at our disposal. And I'm going to pose that question, of course, to Dr. Jessica Shearer and, of course, Thomas O'Connell as well. So, Jessica, do you want to go first in tackling the question around, the tools and resources and recommendations that we can leverage?
Thank you so much, Rispa, and hello to everyone. It's so wonderful to be with you today. I'm actually going to pass it back to the chat and to the panelists, because we from IA2030 want to hear from you. What tools do you need? What resources will help you with these enablers? Maybe let's start, Folake, Dr. Folake, if you want to kind of get us started, then we can go back to the panelists and to the chat to hear how can IA2030's working group, how can we help support these amazing, important efforts that you're all working on, and make sure that you have the resources, tools you need that we're sharing across countries like we're doing right now. So Folake, over to you.
Thank you so much, Jessica. And you put it so nicely. We really want to hear from the participants today and the panelists in terms of what are those technical gaps or resources that you think would be helpful in terms of really being able to roll out both. And part of, as I was listening to the discussion today, it seems that a lot of it is really depends on the leadership's vision to be able to articulate a strategy and implement this. So what type of technical resources or tools do you think would be helpful in this regard? And I'm going to, Rispa, if you allow me, look out in the chat if there's anything. And I actually would love to welcome, yes, participants who want to speak to that are welcome to do so. I'm looking for hands, really looking for hands.
Yeah, I think we have Mohammed and Mercy's hand were up.
Okay, let's take Mohammed. Your hand has been up for a while. Okay.
Thank you very much. And all the colleagues from the international communities, and especially the host, Rita. Really, it's a great opportunity. We are daily learning, even from our junior staff, vaccinators, injectors. So it's a great opportunity that we are learning from the international expertise. So regarding opportunities, I was typing in chat box. The first thing is to develop a synergy between routine immunization and other public health programs. Second thing is we should provide uninterrupted logistics supply. And the third thing is enhanced outreach activities. And the last but not least, we should build the community trust. I would like to share one example. In Pakistan, we are going to launch a National Immunization Day for polio from 13th to 17th of December. So during this campaign, Government of Pakistan and all the partners have decided that in each community, there will be one routine immunization session that will be paid by the partners, and there will be one separate dedicated COVID vaccination teams, so that at the same where we are using all the polio assets to enhance the routine immunization and at the same time for the COVID vaccination as well. So it will be a unique experience in Pakistan, and I hope it will build the trust of community, and it will also strengthen the routine immunization. Thank you very much. That's all from my side.
Thank you. Thank you so much, Mohammed. Rispa, can I call one more hand? Okay.
Yes, please. Yes, please. I see there are quite a number.
I see Khalid. Did I get that right? Khalid Abubakar.
Yeah, thank you very much. Good afternoon, everyone from Nigeria. Actually, I really appreciate the input from all the previous presenters, and in my own actually recommendation regarding technical resources or tools used to help to achieve areas of integration between COVID and routine immunizations. First of all, I know that most of the previous has already mentioned, but community ownership is one of the areas that I think is very important, especially when you look into the challenges we are having, especially in Nigeria, to do with the vaccine hesitancy. And actually, that has resulted in misinformation and rumors. So some of the tools that I think are very important here is that there's need for us to have a very good evidence generation, generation of data from various sources, especially the social media, in order to have maybe a structure like what we have in Nigeria, the Crisis Communication Center, which is an emergency approach to see how we can be able to overcome or maybe counteract some of the rumors that are shared for the people, which reduce the uptake and actually the confidence for people to seek for the vaccination. So definitely, what I think another one is the area of integration to see how we can be able to ensure continuity of essential services, like the current strategy in Nigeria, the scale strategy, where service delivery initially were centered basically within the community. And the health workers, because of the challenges with human resources, we don't have enough that they can be able to go around to the community and reach out to the people. We know that COVID vaccination is given to healthy people, and some people actually may not come for the vaccination. So if we can be able to saturate the media spaces with adequate information, and then integrating RI with the COVID, going into the community hubs, and then ensure that we expand the site for people to easily reach to get their vaccination. And then along the site, the issue of routine immunization is being integrated so as to be able to look into sustaining the indicators in the routine immunization so as to avoid any negative consequence that the COVID has brought in terms of service delivery. Thank you very much. That's what I have. Over.
Thank you so much. Let me just really say a huge thank you to all the participants. We are coming towards the end of the session, and Rispa, what do you say that we give the panelists 30 seconds each to give their last remarks?
Absolutely. That's actually right where I was going to. I think we can just give them 30 seconds, just closing remarks. So I'll now start from the beginning again, and we could perhaps start with Yasir, just 30 seconds, a quick message.
Yeah, so quick messages, placing accountability in place in the system so that we can efficiently use the resources in future, and learn from the system how we can mobilize the resources from within the system, rather creating putting new resources in place just to roll out the COVAX. We know from our field experience that current resources can be enough to deliver the vaccines. So that's my, but accountability is the major thing to create.
Thank you so much, Jasir. Christine, any closing remarks?
I think workforce is coming through as a really strong theme, but we can, recognise now that we have gotten so many people trained in immunisation and interested in immunisation, and we've got new partnerships that can really, I think, enable us to work more closely with the community in a way that we could probably have never imagined when IA2030 was being developed.
Thank you so much. Dr. Abiu, do you have any closing remarks?
Right, so for me, the comments I wanted to make lastly is that there's a need to have a clear objective of ensuring routine services continue to be provided in the midst of the outbreak, and then we work consciously for it. There's a need to maintain strong political leadership and commitment to the process. We need to continue engaging all stakeholders, including our communities and the clients to which we are responsible for. And there's a need to continuously build the capacity of our staff for both routine immunization and the COVID-19 outbreak management. And lastly, I think there's a need to continue to provide regular feedback on both routine services and the COVID-19 vaccination through a framework of accountability.
Thank you. We will move
that way. Everybody's consciously aware there's a need to, so that the unintended effects of
So sorry, I think you cut off there. Dr. Ateke, do you want to jump in and give us your 30-second remarks to close? Dr. Ateke?
Yes, thank you so much. What I will say is that COVID-19 has been a major problem globally and greatly fragilizing the health sector. But I think that at this point in time, we need to take every advantage that the COVID context also bring to us, because at this moment, COVID pandemic vaccination rollout is helping us to strengthen our cold chain and logistics. It's also helping us to gain skills in managing routine immunization activities. And I think it's also an opportunity at this time to strengthen community engagement. So from this perspective, I think that we should look at the other side of it. What can we do better in this context of COVID, such that COVID does not only be a problem to us, but it also helps us to have some good news to tell. Thank you so much.
Thank you so much. Dr. Gubio, last remark, 30 seconds.
Hello. Yeah, so I would like to say that we can, for the part of our own people, we should be encouraged, and then we should keep to the COVID-19 protocols, as the face mask, washing of hands, keeping of distance of 2 meters. And on the part of our government, would like to say that the government can encourage the people by making the vaccines available and easily accessible. We can also involve stakeholders, partners, and then the private sectors to create awareness and also encourage the people in order to build their trust and see that the COVID-19 is acceptable all over the country. Thank you.
Thank you. And with the interest of time, I will hand over back to Dr. Folake. And thank you for the opportunity again.
So let me thank all the panelists today. This has really been exciting and helpful to hear directly from you, your experiences, as well as how this can be done. The examples you provided are really helping to inform global policy and shaping how this is shared with others. So thank you all, and to the audience, thank you for your very active participation. Let me also thank RISPA as well as Palenfo, our excellent moderators for today. We do have a networking session that's coming right after this, where we can continue this conversation, but we also want to hear from you looking at the broader framework around IA2030 and what we see are the immediate but also the next phases for that. And so with that, let me once again just quickly summarize. There were many points that came up, including political leadership, commitment, having an intentional strategy. There were points around using opportunities for new technology and innovation. And there was also the issue of capacity building. Logistics, supply chain came up a lot as opportunities for strengthening, and also the community engagement came out several times, reinforcing key messages. But overall, I come away very positive that the imperative of balancing both is actually very feasible. Many of you are already doing it because we know that the gains cannot be lost in terms of routine immunization, and we need to close the immunity gaps today. And so really thank you all for your engagement online and in this session in the chat. Thank you very much on behalf of the IA2030 Working Group. Thank you all.
All right, wonderful. Thank you, Dr. Folake and the panelists. What a great, very interesting, fascinating exploration. It's not over. If you'd like to continue this conversation, my colleague Ja has been posting the link to join the brainstorming session. So that will require you to go to Hopin. I'm going to quickly, before we switch over to our next session, we're going to be starting maybe 1 or 2 minutes late. So I'd like to ask our panelists for the next plenary session for their indulgence. I'm just showing here right now you have been in the plenary. You can stay in the plenary, and let's go to the reception to see what is actually happening here. So we have, on the one hand, the follow-up to this consultation, the brainstorming to co-create a common dialogue with participants. You can go to networking. You can see all three of these options. Stage, sessions, and networking are open, or you can look at what we're going to be discussing next, and that is here, the plenary on challenging vaccine hesitancy in districts and health facilities. So we're going to take mark a pause as we switch over to the next live streaming session. We'll be back. You can stay if you want to stay for the next plenary session. You don't have to go anywhere. Stay right where you are. We'll be right back. If you're on the stage, so if you are here, you'll see the link here in the middle will change to the vaccine hesitancy live stream. That will take 1 or 2 minutes to set up, and then we'll be getting started. Thank you very much indeed, and take care. You should now see, if you're on the stage, you should now see this instead if you're watching on YouTube, LinkedIn, Twitter. We had, I forget we'll share the exact numbers, but we had a lot of people joining this session, obviously, a lot of interest in the work that you're doing, Folake and colleagues. We'll kick off now with the next session. Thank you, and see you in